Pico question by Zach Simmons. The question: does a torn rotator cuff benefit more from surgery alone or physical therapy post-surgery? Search strategy and article identification. The search included rotator cuff tears and rotator cuff rehabilitation. The article I chose was a systematic review about adults undergoing physical therapy for rotator cuff disorders, and the article was searched on PubMed and the full text was accessed on the Oxford Academic. Rapid appraisal of the article characteristics. Level of evidence is a 1, and the article contained evidence from a systematic review of 5 studies of adults over 18 years old. So study 1, the Halgren, had a sample size of 102 people and data on 95. The Hung study had 33 people. The Cromer study had 90 people and data for 88. The Marola study had 60 people, and the Talzer-Am had 102 but only data for 89. Rapid appraisal continued. The Halgren had a 1-year follow-up, and the dropout rate was 41 people. The Hung study had a 6-week inclusion of rehabilitation, and the dropout rate was 23 people. The Cromer study had a 12-week conclusion of the intervention, and the dropout rate was 88 people. The Marola study had follow-ups at 6, 9, and 12 months post-treatment, with a dropout rate of 33 people. The Talzer-Am study had a 12-month follow-up at the clinic, and a dropout rate of 89 people. Description of the study. The 5 studies totaled 387 patients that aimed to undergo physical therapy and predict their success rate. The study had some considerations removed due to high risk of bias and concerns of applicability. None of the models were ready for use in practice. 2 studies had patient populations selected by their agreement to participate, reducing their external validity. The physical therapy in the study by the Talzer-Am was insufficiently described, while the other studies had standard practice. Modalities used throughout the studies. One study used a fast-track motion analysis system, which is unavailable in most clinical settings. The Halgren study gave the option to undergo surgery. Results. According to the article, the models used in the 5 studies do not have enough information to predict the outcomes of physical therapy. With that being said, further testing will be done. Individual case review of the Marola study. They had 60 participants with a systematic rotator cuff tear. Their treatment included pain control, passive mobilization, supervised exercises, and laser therapy, and their duration was unclear. The patients were measured at 6 months, 9 months, and 12 months post-therapy. The end results were unclear due to hindered data extraction. This specific study had external validity due to the simplicity of modalities and generalization to a wide variety of patients. The study was also done within a clinic and not a lab, allowing for more possible patients. Application to practice. The Marola study included modalities such as laser therapy, passive mobilization, and supervised exercises. I agree with their theory on handling pain control first as well. Their model of treatment goes along with what we learned in class. Passive mobilization. The picture represents a passive mobilization exercise called the pendulum. The patient allows gravity to take over the arm as they slowly rotate circles around it. Summary. Although this study focused more on the training plan to increase successful rehabilitation treatments, rather than if a torn rotator cuff benefits from surgery or physical therapy, the evidence shows that all cases are different. Each patient will need to be addressed individually and specifically, rather than using a model for all rotator cuff tears.